Assalamualaikum. So today we are going to discuss the trachea, which is present in the superior mediastinum. First of all, we will see a brief introduction of the trachea. So the trachea, it is also called as the windpipe, as it is transferring the air, and it is present in superior mediastinum only. Because it bifurcates into the main bronchi at sternal angle superior to heart, so it is not present in the inferior mediastinum, and it is about 10 to 15 centimeter in length. Okay, and it contains the C-shaped cartilages which prevent it to collapse. Okay, C-shaped cartilage, and these cartilages about 16 to 20 in number. Okay, so now we will first see a trachea in the form of diagram, and then we will see its the arterial, venous and lymphatic drainage, etc. We will draw it here. So the trachea enters the thorax anterior to the esophagus. It is smooth from the posterior side, and that smooth side is placed over the esophagus. Okay, so it is anterior to esophagus as it enters to the thorax. Okay, then it will move right to the right recurrent laryngeal nerve, means on its left side will be right recurrent laryngeal nerve. Okay, then it will move posterior to three arteries. We will discuss them here. The first one is arch of aorta. The second is brachiocephalic artery. And the third one is the left common carotid artery. Then it will move inferiorly, and on its right side, this side will be the right lung, and on its left side will be the left lung. Okay, this is right lung and this is left lung, and similarly on its right side will be the right pleura, which is a sac surrounding the heart. On its left side will be left pleura and right pleura. Okay, then it will move in. Then it will move inferiorly, and at the level of sternal angle it will bifurcate into two main bronchi. We will draw, this will be the sternal angle. Okay, manubrosternal joint. Okay, this is sternal angle or the manubrosternal joint, and at the level of this joint it will divide into two main bronchi. This will be main bronchi. So this is the course of the trachea, and why it is not present in the inferior mediastinum, because it is dividing at sternal angle, which is above the heart, so it is not present in the inferior mediastinum. Now we will see the arterial supply of trachea. So the arterial supply to trachea is through the inferior thyroid arteries. Inferior thyroid artery. Now we will see the venous drainage. So the venous drainage to trachea is through the left brachiocephalic vein. And the lymphatic drainage so its lymphatic drainage will be through the pretracheal and paratracheal lymph nodes. Pretracheal and paratracheal. Lymph node. And its nerve supply will be the parasympathetic and the sympathetic. Parasympathetic will be through the vagus nerve, and the sympathetic will be from the fibers from the middle cervical. Okay, so sympathetic supply will be from middle cervical fibers. And parasympathetic will be through vagus. Parasympathetic will be through the vagus and the recurrent laryngeal. Vagus nerve and recurrent laryngeal. So this is a brief introduction of the trachea, its nerve supply, blood supply, lymphatic drainage, and its relation with the several structure in the superior mediastinum. Thank you.